Hello, my name is Philip Sappi, and this is my capstone intervention project for my client Paula. My client Paula and I met on March 6th to discuss my intervention on improving her hypertension self-management skills. We met for 3 hours at my client's house to implement a wellness plan that using the hypertension self-management PowerPoint I created. To improve my client's understanding of hypertension, I wanted to create a plan that was specific to her needs. To achieve this, I assessed my patient for any barriers to hypertension management, her previous knowledge of hypertension management, and any personal goals my client has had for her health. My client has experienced several problems managing her hypertension in the past. First, she had a problem with medication adherence. For example, she had stopped taking one of her blood pressure medications due to the side effects involved, particularly muscle cramping and tightness. She had not informed her primary physician about this for months. Second, my client had not been measuring her blood pressure at home. This is problematic for monitoring the effectiveness of her current medication regimen. Third, her diet and exercise routines were not conducive for this hypertension management plan. My client tended to avoid higher sodium foods, but she still drank multiple sodas each day and did not limit her fatty red meat intake. Moreover, she lives a mostly sedentary lifestyle and did not exercise outside of daily house chores. Intervention overview: self-management skills. To improve my client's hypertension management, I prepared a PowerPoint presentation to educate my client on several hypertension self-management skills. The PowerPoint included information on home blood pressure monitoring, the DASH diet, peer-reviewed exercise recommendations for adults with hypertension, and community resources for hypertension management. My intervention aimed to improve my client's self-management of hypertension through several applicable skills. The application of these skills can be used for daily management of her hypertension. My first intervention was to teach my client home blood pressure monitoring. This skill, as recommended by the American Heart Association, should be completed twice in the morning and twice in the evening. American Heart Association 2023. The skill of performing a home blood pressure check was guided by the Centers for Disease Control and Prevention, CDC, recommendations for home blood pressure monitoring. This educational piece was obtained from the CDC's educational tool, The Correct Way to Measure Your Blood Pressure. I evaluated my client's skills through a demonstration process where she described the CDC guidelines and performed a self-monitored blood pressure check. My second intervention was implementing a dieting plan through the guidance of DASH dieting, dietary approaches to stop hypertension. The DASH diet was developed by the National Heart, Lung, and Blood Institute, NHBLI, to reduce the negative health effects of hypertension. This initiative focuses on, quote, eating vegetables, fruits, and whole grains, including fat-free or low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils, unquote. National Heart, Lung, and Blood Institute 2021. The knowledge obtained from a dieting plan is crucial for daily management of hypertension. For this skill, I was teaching, implementing, and evaluating my client's knowledge on proper dieting for controlling hypertension by utilizing the information provided by the NHBLI on DASH dieting. The knowledge presented in my PowerPoint included information on serving sizes for the 8 different food groups, sodium limits, DASH eating plan examples, my plate, and the U.S. Food Data Central. My third intervention was evaluating my client's current exercise routine and discussing agreeable options for daily exercises. Exercise is another important option for patients struggling to control their hypertension. Since my client lives a mostly sedentary lifestyle, I needed to stress the importance of incorporating exercise to prevent complications associated with uncontrolled hypertension. I used the article Evidence for Exercise Training in the Management of Hypertension in Adults, where Alexandra Gotti recommends, quote, each patient should do at least 30 minutes of continuous or accumulated, e.g., 3 intervals of 10 minutes, exercise per day. It should include aerobic exercise, supplemented by resistance training. Unquote, Gotti 2015. Additionally, I utilized information from the U.S. Department of Health and Human Services Physical Activity Guidelines, 2nd edition, for exercise recommendations for aging adults. Intervention response, home blood pressure monitoring. It was relatively easy for my patient to learn how to self-measure her blood pressure at home. The primary challenge for teaching this skill was setting up my client with an appropriate device. I provided guidance on selecting an appropriate blood pressure cuff based on the recommendations from the American Heart Association. We selected Omron Silver, an upper arm blood pressure monitor, as recommended through www.validatebp.org, which is endorsed by the American Heart Association and managed by the National Opinion Research Center at the University of Chicago. I ensured that the cuff was the correct length for my client's arm size. My client had expressed using a wrist-worn home blood pressure monitor in the past, but she did not replace this device after it stopped working. I informed her that these devices are not recommended by the American Heart Association due to the less reliability when compared to upper arm cuffs. American Heart Association 2023. My client had some difficulty remembering the checklist provided by the CDC for measuring home blood pressure. I provided a list of all the steps recommended by the CDC to help remind her. After a few attempts, my client was able to verbalize and demonstrate the list of important steps by memory. Additionally, she stated that she would check her blood pressure before taking her morning dose and evening blood pressure medications. I recommended apps to help track her daily blood pressures, but my client preferred to keep a track of her pressures in a written journal. I provided her with copies of the blood pressure logs that are available from the Department of Health and Human Services. My client and I reviewed the importance of medication adherence, since this has been a problem for her in the past when she developed unpleasant side effects. After reviewing the potential side effects of ramipril, nebivolol, and amlodipine, she agreed to contact her primary physician if she develops unpleasant side effects before she stops taking her medications. We also discussed what a hypertension crisis is and how to respond to one. My client was able to verbalize that a hypertensive crisis is when your blood pressure exceeds 180 over 120 millimeters mercury. I stressed that this is a dangerously high blood pressure reading and may result in organ damage. I also taught my client that the American Heart Association recommends calling 911 if your blood pressure is over 180 over 120 and you develop quote, chest pain, shortness of breath, back pain, numbness or weakness, changes in vision, or difficulty speaking. Unquote. American Heart Association 2023. Intervention response diet plan. My client was able to identify the different food groups that were necessary for a DASH diet. My client was surprised that this dieting plan would limit sugary beverages. She initially believed that avoiding sodium was the only important food to avoid, and that excess sugar did not matter. My client had previously been interested in changing her diet, so she was more engaged in this education session. We discussed the recommended serving sizes based on a 2,000 calorie diet and recommendations from the National Heart, Lung, and Blood Institute. As recommended in the 2,000 calorie a day diet, we aim to increase her daily servings of whole grains, fruits, and vegetables. The daily serving recommendations was listed as follows: grains, 6 to 8 servings, poultry and fish, 6 or less servings, vegetables, 4 to 5 servings, fruit, 4 to 5 servings, low-fat or fat-free dairy, 2 to 3 servings, fats and oils, 2 to 3 servings, and sodium levels of less than 2,300 milligrams. The National Heart, Lung, and Blood Institute, 2021. My client was able to identify foods that fit each category. To figure out how much was needed for each serving size, we used a tool provided by the U.S. Department of Agriculture called My Plate. This tool allowed us to explore the food groups outlined in the DASH diet. The My Plate app also provided nutrition information and what constitutes serving sizes for different fruits, vegetables, grains, and meats. My client was able to verbalize an understanding of the importance of following daily dietary recommendations. Additionally, she was able to correctly utilize My Plate and the U.S. Food Data Central to create a mock diet plan for one day that met the requirements of the DASH diet. Intervention Response Exercise Plan. Out of all the interventions, my client was most resistant to the exercise plan. My client had cited joint pain and general fatigue as barriers to this intervention. To overcome this barrier, I recommended low-impact exercises as an alternative to sports activities. With this compromise, my client said that she would try to exercise at least 3 days a week to start with. She expressed little interest in exercising every day, though. I told her that she should still try to aim for 150 minutes of aerobic exercise each week. We discussed the various forms of exercise she should try for low-impact exercises. These included swimming, using her elliptical, and walking, and using exercise videos. We reviewed the Move Your Way exercise planner provided by the U.S. Department of Health and Human Services. She was able to utilize this tool to create an exercise plan for the week that reached 150 minutes of aerobic exercise. Additionally, I stressed the importance of using resistance for strength training. My client said that she would try hand weights and resistance bands while watching television. I reiterated that with resistance training, she should attempt to perform 3 sets of 8 to 12 repetitions for each type of exercise. I encouraged and evaluated my patient's ability to perform her chosen exercises. She spent approximately 15 minutes on her elliptical and took a break. Then we spent another 20 minutes walking around her neighborhood. She did endorse joint pain after walking around the neighborhood, which was one of her barriers to exercising. My client was able to verbalize an understanding of regular exercise in the management of hypertension. Assessing satisfaction. Overall, the care plan was well received by my client. She described her individual needs for each intervention and contributed to the creation of a more individualized care plan. She was satisfied with the level of information that I provided for her and believes that the topics discussed, particularly the dieting plan, will be beneficial for managing not only her hypertension but her overall health as well. She had thanked me for providing the education and the motivation to help her make the efforts to change her diet. I asked what my client had felt regarding her quality of life with the plan. She believes that it will not interfere too much with her daily routine, and that it is well worth it if she is able to avoid the negative health consequences associated with untreated hypertension. Peer-reviewed evidence and literature. The recommendations provided to my patient in this care plan were created through the teachings and recommendations of several credible sources. As previously mentioned, when creating the care plan, I use recommendations from the CDC for measuring home blood pressure. These tips included not eating or drinking for 30 minutes prior to taking your blood pressure, emptying your bladder, remaining seated for at least 5 minutes before measuring, uncrossing your legs and keeping them flat on the ground, keeping your arm level with your heart, placing the cuff against your skin, and not to speak during measurement. Centers for Disease Control and Prevention, 2023. The American Heart Association and the National Heart, Lung, and Blood Institute were utilized for community resources and dieting information. Finally, I utilized the information from the article, Evidence for Exercise Training in the Management of Hypertension in Adults, to develop my client's exercise recommendations. I incorporated the information provided by these sources into a uniform teaching program that encompassed many dimensions of hypertension management. Each intervention in my care plan utilized a different credible source so that my client received a thorough educational tool for managing her hypertension. Technology to improve outcomes and communication. The use of healthcare technology was essential for teaching my client how to self-measure her blood pressure. We used an automatic blood pressure cuff to monitor my client's daily blood pressure readings. We utilized the MyPlate app for food recommendations and serving sizes to adhere to the DASH diet. Through this app, my client was able to identify foods within each food group that she would try to eat more of. Additionally, we discussed the use of telemedicine as an option for hypertension management. Telemedicine would allow my client to discuss topics with her primary care provider regarding the management of her hypertension. She mentioned that she would like to use this in conjunction with her regular in-office appointments. The incorporation of healthcare technology will be necessary for improving patient outcomes. Technology offers many opportunities for patients to improve their daily self-management through easy-to-use tools. As described in the article, Novel Digital Technologies for Blood Pressure Monitoring and Hypertension Management, Allison Hare underscores the importance of home blood pressure monitoring for, quote, increasing patient engagement and improving clinical efficiency and outcomes, unquote, Hare, 2021. Impact of health policy. My care plan was created with regard to common health policies for nurses. I used information from Maryland's Board of Nursing and Maryland's Nurse Practice Act to understand the scope of nursing practice when creating and delivering a care plan. The nursing standards outlined in the Nursing Practice Act describe nursing care planning as, quote, monitoring the structure, process, and outcomes of nursing practice with consideration for access and cost, unquote, Legal Information Institute, 2023. By understanding the scope of nursing practice, I was able to implement information from reputable organizations, such as the CDC and the American Heart Association, into my care plan to improve my clients' outcomes. Additionally, I used the information from the Health Resources and Services Administration, HRSA, to find a community health clinic that was close to my client's house that specialized in hypertension management. This would satisfy my role in improving access to resources and reducing costs to my client. The time spent with my patient is important for the development of nursing policies. Nurses have a close relationship with their patients, so they have a better understanding of how a patient is affected by governmental and organizational policies. For example, during this capstone project, I learned that a patient that suffers from poverty may not be able to afford a home blood pressure monitor, which is typically not covered by insurance companies. My client was very capstone outcomes versus initial predictions. My client was very receptive to the care plan that I created. I had originally predicted my client to have some resistance to the suggestions of daily exercise, which was one of my findings after initiating my care plan. I initially thought the information would be too overwhelming for my client at first, but we took the time to cover each topic thoroughly. Allowing my client to take her time and ask questions as we went along helped reinforce the best nursing practice standards. My client exceeded expectations by wanting to change her diet. This section of my care plan prompted my client to ask more questions and lead to me recommending an additional tool, the My Plate app, for food recommendations. I believe that my intervention could be adopted as a best practice tool for patients with hypertension as it promotes medication adherence, a diet proven to be clinically superior for hypertension management, and an exercise routine that is recommended in peer-reviewed articles. Outside of the one-on-one intervention, other people could benefit from the interventions in this care plan. The recommendations in my PowerPoint could be condensed into a product as simple as a brochure that could be distributed in the community or a hospital setting. Assessing my growth. After completing the RN to BSN program, I feel like I have matured as a nurse. This program allowed me to take a step back from the bedside nursing to view patient care from a different perspective. I was able to learn about leadership strategies, change management theories, patient safety and quality improvement measures, healthcare technologies, care coordination, and community health nursing. The accumulated knowledge gained from this program was directly applied to my client. I was able to utilize the skills and knowledge to provide a care plan that utilized many topics covered throughout the program. I feel as though the course has prepared me to be a better leader within my field. This will be beneficial for my patients in the future and may lead to career advancements with the knowledge I have acquired. Thank you for watching. This is the end of my project.